For me, it's about being able to do the things that I really want to do, like being able to go out and walking the dog, being able to get to church, going out and have a coffee with friends, just so that I feel normal, for use of a better word, and doing the things that other people around me are doing.
It doesn't matter to me that I had to change my lifestyle very much, but it does matter to me that I can, within that environment, can still have a life.
I've quite often quoted somebody who said, we don't want better services, we just want better lives. It's the quality of my life that's important to me, and my relationships and friends.
Knitting has always been a part of my life. About 5 years ago, several friends, ex-colleagues, and I got together and we used to meet in a cafe just to knit. They are my source of support. You know, we all do things for one another, but also they're links with my old job. I can still keep up with my old job by the conversations we have. And interestingly, this Friday morning meeting clashed with some pre-arranged physio that I had to have after my operations. And I went along to the first set of it, and then when I had the second operation, I thought, do you know, I know what to do. I'd just rather go to my knitting group. I get much more help and support from them. And I know how to do the physio, and actually I'll walk to my knitting group. Originally I just walked a short distance and then somebody gave me a lift, but then I gradually increased, so I was getting better just walking to that.
We have a family wedding coming up, and I wanted to know how to manage my diabetes especially, and learn some form of dancing to be my exercise of the week. Healthcare professionals as well, you know, are taught in diabetes that the main goal is your blood sugar level, is to your HbA1c as it's called. And so they want to reduce that. Whereas that may not be my personal first aim. My aim was to learn to dance tango. But knowing what they could do to support me to learn to dance tango and how that would work to support their aim of reducing my HbA1c through exercise, I think that's when they saw the value in it. But I did have to, you know, push that myself as being important.
More than including decisions about my care, I want to be a part of planning my care and deciding what the outcomes that I want are. I want to be seen as more than just a condition or more than just a test result. I want to actually be seen as the person who has dreams and hopes and aspirations.
I have spent my whole life trying not to lose sight of Jean. I'm not an arthritic or an osteoporotic or somebody with stomach ulcers or high cholesterol or whatever. I'm Jean.
What matters to me is being myself, being an individual, not just a carer.
And to be valued, you know, not just seen as a set of conditions. I want to, you know, Clinton, see me, you know, that's what matters to me.
Another thing for me is to feel as well as possible on day to day. So I don't want to feel sedated by medication or so sick from medication that actually I can't function. I don't feel my healthcare professionals take my outcomes into mind very much. They often look at the clinical outcomes, the test results in front of them, whereas I would take into account how many days that week I'd been able to get dressed and go out of the house.
Because they're long-term conditions, I don't see an end to it, so I have to live my life with them. And I have been able to live on my own for 3 years now, which is a very big things that I wouldn't have thought I would have been able to do.
Being able to be myself when I'm 70 and to be able to cook for myself, to go for a holiday by myself, and to be able to know that I can be able to sustain the life that I have now when I get to that age.
When my career was stopped, that was devastating. I mean, I was in my mid-40s, so financially that was going to be tough. I'm on my own, I mean, I've got I've got other supportive family members who helped, but that was the first time that actually ill health was really stopping me and stopping what was really important. My professional life was hugely important to me. So what do I do if I'm not a professional? I felt I'd lost part of my identity.
People do not treat pain the way it should be. They would do all sorts of ECGs, bloods, etc., but nobody was listening to the level of pain I had. I had no pain medication for hours and hours and hours. The best I was offered was 2 paracetamol.
My surgeon, who obviously I sort of came to him through a situation where like we have to operate within the next day sort of thing, but now I've kind of got a relationship with him over like the last 4 years, and I feel he does listen to me. He does take into account my personal outcomes when I discuss with him what's important to me. Sometimes I do have to reiterate things. For example, I've had to say on a number of occasions to him and to the kind of registrars that work with him, because they don't always seem to write things down, no, I don't want to have the next stage of the operation. I don't want to have a reversal, an internal pouch, or I don't want to have my rectum removed until I've at least tried to have a child. I don't want more pelvic surgery. Can you please just put that off? Can you put that in my records? And he will respect that, and I think he gets that now. Another good experience would be where I've had IVF treatment on the NHS, and they put me in touch with a doctor who was really good. She was brilliant. I mean, she always refers to me by my first name to the other staff as well. She listened to what I'm saying. She's read all the research. Instead of just going, oh, here comes Dr. Google with something she printed off. She read all the research and got my bloods done for all these autoimmune antibodies. And I was right, and I did have them. And they adjusted my protocol accordingly, gave me 3 months of steroids before the next round of treatment, gave me different injections than the ones I'd had previously that I'd had a bad reaction to. And I'm now 18 weeks pregnant. So I think she's done a fantastic job of, respecting my personal outcomes,
This is a shared aim around, giving patients a voice to say what is their actual most important aim. And it may not be a blood test or a urine test. It could be that they want to dance tango, or they want to be at their daughter's wedding, or they just want to lower their pain a little bit. And then if you can put the blood test and the urine test in the context of that, it does seem a lot nicer for, if I was a doctor, to be able to say that's my job, is helping someone achieve their goals in life rather than taking blood tests and urine tests.